Let's go across to our guests now. We have Rijo John, a health economist, with us. Partha Mukhopadhyay is a senior fellow with the Center for Policy Research, and Dr. Sudarshan Ballal, chairman of Manipal Hospitals, joining me on this very critical discussion on the COVID spike that is being reported from 5 states of Delhi, Rajasthan, Himachal Pradesh, Haryana and Gujarat. Let's go across to Rijo John first. Sir, you had tweeted about the daily cases rising in Delhi and the National Capital Region. Why do you think these cases are seeing a spike?
The festival season is here. That could be the most important reason. Your reporter was reporting that rightly some time back. In fact, when we see the Google Mobility Index, we can see that in many of these areas, the mobility now is almost at the same level as it was in the early part of the year. So clearly there is increased mobility, and a lot of the districts in the NCR region are seeing rising in cases on a daily basis.
So is it primarily because of this mobility over here? Also, Mr. John, I wanted to ask you, the government is telling people to observe social distancing and adhere to COVID etiquettes. But the government has allowed full capacity buses and the traffic is normal in the national capital. Do you think the entire onus is on the public to observe COVID etiquettes, or is there some responsibility of the government as well? How much responsibility of the government is there?
Well, once you open up the markets and, public spaces like that, it's really difficult to ensure this kind of social distancing norms. People, once they get the freedom to move around, obviously it's very difficult to enforce these kind of disciplines in people. So I think on a large part, it's the government's responsibility to see to it that you restrict gatherings beyond certain numbers, especially at the time now when, when I was looking at the data now, Delhi and Haryana alone are contributing close to 21% of the total cases reported in India the last 1 week. And that has actually gone up from 16% a week back. So you're clearly seeing that increased daily new cases particularly in Delhi and Haryana region. But then on the other hand, you don't see the testing has also not gone up at the same level. It has remained close to 7% of the total tests done in India from these 2 states alone. So on the one hand, you see that, there's a rising cases and the percentage contribution by these 2 states are extremely high. I mean, much larger than what it was a week back. But then testing has really not caught up accordingly.
All right.
And proportionately.
Right. Let me go across to Mr. Mukhopadhyay now. But before that, the Center for Policy Research has made an important claim that number of missed COVID cases is on the rise. So are the actual number of cases much higher? Their report studies the implied positivity rate, and according to it, more than 1.2 lakh undetected cases. There could be more than 1.2 lakh undetected cases in the last 1 week. Partha Mukhopadhyay, tell us how you've arrived at this conclusion that there may be many thousands, in fact, over 1 lakh undetected cases.
Good evening.
Yes.
The issue is actually quite well known. We are just merely calculating some of the numbers and standard data that's actually been put out by ICMR. And this is a phenomenon that's been going on since about August, because there have been 2 broad changes in the testing strategy since then. In August, the various governments introduced the use of rapid antigen tests, which have lower sensitivity, which means they pick up fewer positive cases than the RT-PCR test. And secondly, you have a situation where somewhere around mid-September, roughly around the time when we see the drop in COVID numbers in our data, ICMR has introduced self-testing. We don't really, so these are the 2 events that have happened since August. That's basically been driving most of our numbers. So it's fairly easy to calculate what the number would be if you make certain assumptions about what the sensitivity of the relative sensitivities of these two tests are, which is the rapid antigen test and the RT-PCR test. And if you know what the proportion of RT-PCR tests are. In Delhi, that's actually quite high, and it's been high for some time.
Yes.
Rapid antigen tests have been high for some time. And consequently, what you see, therefore, is you can therefore calculate that if we had used RT-PCR tests instead of rapid antigen tests, how many more cases would have been detected?
Right.
And that is the number you're talking about for the last 5 days or so. And that's actually a low number because, as you can see, overall the number of cases are coming down, overall the positivity is coming down.
Yes.
And therefore, given the structure of the cases, the last 5 days is relatively low. In fact, if you go back to the beginning of August, we might have been missing, depending on what the proportion of rapid antigen tests are, we might have been missing upwards of 1.2 to perhaps even over 3 million cases for this period.
Right. Mr. Mukhopadhyay, I'll come back to you. I want to go to Dr. Sudarshan Ballal. How serious do you think is the situation if we have these thousands of undetected cases, as the CPR report has claimed?
Good evening, Rohit and my fellow panelists. It's good to be here again. Just when we thought we had conquered the COVID pandemic, we have some disconcerting news of a second wave and possibly a third wave in many places like Delhi and a few other states that you mentioned. Coming to the specific point that you asked me, are there more cases out there than what has been detected?
Yes.
The answer is definite yes. And the simple thing that we have now is that you know the zero prevalence of the presence of antibodies in different states, and that certainly is far, far higher than the detected cases even by RT-PCR. We have another issue here, which is the rapid antigen test, where the false negatives are high, which means there are a lot of people who actually have the disease may not show as positive in the rapid antigen test. Hence, it's not a big surprise that there are more cases out there than what is actually detected by the RT-PCR test or the rapid antigen test. So the point to take home is that we should not let our guard down. Just because the number of cases are coming down, COVID is still out there. It's looking for you. So you have to be safe. And common precautions like mask, distancing, hand wash, cough etiquette is what we need to follow till we completely conquer this pandemic.
Yes. Mr. Rijo John, the Delhi Chief Minister is saying in 1 week to 10 days, the situation of coronavirus will be in control in the national capital. You've been looking at the data. Do you share that optimism?
Well, it's difficult to say like that because, at the moment, Delhi's test positivity rate is on a rising path. When I track the 7-day average test positivity rate, Delhi is at 13% right now. And it used to be like 11% a week back. And this is the time when the government must be actually increasing the daily number of testing. Otherwise, you risk, losing out a lot of cases. I mean, there will be much more undetected cases out there, like the other panelists already pointed out. So when your test positivity rate is on a rising path, instead of increasing the number of testing daily, Delhi seem to be either keeping the testing steady or decreasing a little bit. And that's not the right thing to do. And, if you actually decrease the testing, of course, you would see a decrease in cases that are reported. That doesn't mean the actual cases are coming down.
Dr. Ballal, I want to ask you these 5 states that we're looking at, Delhi, Rajasthan, Himachal, Haryana and Gujarat, which is seeing increased number of cases. Do you think what is needed here is what some of the experts call a circuit breaker lockdown? Would you advocate that?
See, this is $1 million question. I have seen the various aspects of lockdown right from the time COVID came to India until the lockdown was opened up in a phased manner. Localized lockdown in certain areas may be an option, but certainly widespread lockdown, I think, is going to be hurting the economy and the people at this juncture. So we should look at other means of controlling this disease. I think we should be a lot more strict in trying to prevent spread of disease by simple measures, which I had mentioned earlier, than go for a lockdown. I think citizens have to be sensitive. This cannot be done by the government alone. Citizens have to be sensitive and responsible.
But there are crowds in the markets, sir. You see in Delhi, in Bombay, there are huge crowds at the market ahead of this festival season, in this festival season, in fact. So how do you control it?
Absolutely. One is we should control these crowds without hurting their livelihood. And that can be mean that you allow them to shop at a specific time, X number of people, just like what we have done with the rest of the places like hotels, movie theaters that have opened up, public transportation, airlines.
Yes.
So also the marketplaces should have a specific time and the number of people allowed should be regulated. And this should be also an awareness created because in a democracy, it's difficult to come down very hard on the citizens.
Yes.
So it should be both a carrot and a stick kind of measure to control the spread of this disease.
All right, let's get back to that CPR report of undetected cases. Partha Mukhopadhyay, how do you suggest that we track these undetected cases that you claim could be in thousands?
Two things, but let me quickly respond to your lockdown question.
Right.
First, the issue here is you need these kinds of lockdowns if your capacity in hospitals is getting stressed. The whole point of a lockdown is to ensure that people can get treatment as and when required. And we need to make sure right now, one of the hopeful parts of the increase right now is fewer people are getting hospitalized now than similar numbers were seen earlier. But we should not depend on this to last. Right? So that's one of the issues that I think I would like to point out.
Yes.
And secondly, it's very hard, unless you have ticketed stuff like cinema halls, to essentially prevent entry. And we just have to take that into account. Given that, what can we do? First, in order to ensure that people can get treatment early, we need to get people to start monitoring and reporting themselves and getting themselves tested as early as possible. That's the first part of the story. But the second part of the story is something that the ICMR has not reported at all. It has not reported its share of antigen tests, and now it is not reporting the share of self-tests. The question is, how is the self-test substituting for contact tracing, or is the self-test supplementing contact tracing? What we want is the second thing to happen, which means that the government's contact tracing program should remain on course. And in fact, if the epidemic is rising, the contact tracing program should be appropriately ramped up along with the rise in cases, because obviously more people, more contacts will then be created.
Yes.
Is that actually happening? Given the flatness in the testing curve, it looks as if that the self-test is substituting rather than supplementing the contact tracing. So what we need to ensure is in all the states, definitely in the states where the cases are going up, but even in other states, because they could be in the same situation sooner rather than later,
yes,
we need to ensure that the contact tracing mechanism is put in place as early as possible. We now have enough testing capacity. There's no reason why we should be stuck at 1 million tests if we are actually seeing a rise in tests going forward.
All right. Interesting questions there and suggestions from Mr. Mukhopadhyay. One final question to you, Dr. Ballal. How hopeful are you of the vaccine?
Well, reasonably hopeful based on the information we have so far.
Yes.
But it's a long way before we get a vaccine for everyone who needs it. And only time will tell us how efficacious it is and how long will it be efficacious. Because we have had many vaccines in the past for many other diseases which showed a lot of initial promise, but
yes,
it did pan out in the long run. But as of now, it does seem to be a useful tool. But till such time that the vaccination is in place, everyone is vaccinated, we cannot let our guard down, and we should not let our guard down. But I honestly believe that we are in a much better position to tackle COVID now than we were 6 months ago. And that's the silver lining in the cloud of corona.
Yes. All right. Rijo John, Partha Mukhopadhyay, Dr.
Can I just
Sudarshan
jump
Ballal.
in for 30 seconds?
Yes, Mr. Mukhopadhyay. Go ahead.
The quick thing is also that we need a certain kind of messaging that's consistent. Right now, the central government is sort of messaging as if this is done and over with. The numbers are coming down. We can afford to sort of believe that the phase is over. In fact, we have even seen that we'll get down to more or less nothing by the time next February comes about.
Right.
We need to ensure that, because if you say that, then you will see this kind of crowd that you saw in Lajpat Nagar and everywhere else.
Yes.
We need a consistent messaging from all governments that we cannot relax their vigilance until the vaccines start coming in, and that is a good year from now if you want to expand it to a large segment of the population.